All three of today's Wildlife Vets International talks have been sponsored by Emerade, who are a division of Lefebvre. So a massive thank you goes out to Emerade for being part of this event and sponsoring these talks. And we have actually donated 50% of their sponsorship fee to Wildlife Vets International to continue supporting their incredible work that they do. So we're just going to watch a short video from Emerade, just talking about their products and how you'll probably notice it later on in the talk about sea turtles. So Emerade, over to you. We're going to move straight on to the next talk now from Tania Monreal and Matthew Rendle, who will be focusing on sea turtles, who they provide veterinary care and rehabilitation support for in tricky circumstances. Tania has worked in zoos and on conservation projects for over 20 years now and is chair of the European Association for Aquatic Mammals Veterinary and Accreditation Committee. Matthew has been an RVN for over 25 years and has a particular interest in exotic species. He is an elected member of the RCVS VN Council, as well as being chair and co-founder of the Association of Zoo and Exotic Veterinary Nurses. Really looking forward to this talk from two excellent presenters, so please do enjoy.
Right. So we are going to talk about veterinary care of sea turtles and the rehabilitation and just present a few case reports and the basics of sea turtle husbandry.
So Tania and I support lots of institutions and charities around the world with trying to offer them support kind of bespoke for their needs. And it's always good to start with thank yous, and really need to thank all of these organizations, not only for their support and helping us with the collaborations, but also for giving us the images we're going to use today. And specific attention to Wildlife Vets International. There's a UK-based charity that supports the work that Tania and I do and really allows us to be kind of as dynamic as we are in approaching different situations in different centres around the world.
So let's get started. Obviously, first of all, a few very, very basic things on sea turtles, just because all these things we're going to talk about actually affects how we approach problems with sea turtles. So obviously, they're aquatic species and they have adaptations to the marine environment. We must never forget, but Matt will talk about that a bit later on, that they're cold-blooded and they have the portal-renal system. So it is very important how we administer the treatments that we do. Plus the lack of diaphragm sometimes influences how we do anesthetics, especially isoflurane anesthesia. But this is just a basic approach on such that you know what we do and why we do this. Sea turtles go from really small animals like nothing, 300-400 grams, even 16 grams when they're newborn, to 170 to 100 kilos. So we need to know how to restrain them. There is a very interesting acupressure point, which is called GB20, and we wanted to show you how it works. So this image is from the oceanographic in Valencia. So you put the sea turtle on a flat surface, and then you press right where the main scute in the head stops, and that's the GB20 point. And it's a sort of vagal response, a bit like us when we press down our nose. Usually in very big turtles, I really need to hold my whole hand, actually, because when they're very big, they are also very strong. But in smaller and medium size, this works brilliantly, and it's a very good tool to use. Other ways of restraining turtles would be, for instance, in smaller animals, we use car tires. In bigger animals, we can go to tractor tires, but sometimes it's a bit too much. But this is, let me get the tone off. So what you would do is you place it in a tire, obviously covered by a towel. And this allows you to work alone or only 2 people, depending on the rescue center. This is very important because not always volunteers are on site, enough volunteers to do what you need to do. So you need to find a way of being able to work with the animals on your own or only 2 people. On the right-hand side, you see the device that they developed in ARCHELON in Greece to actually tube feed big turtles, which is really great. It allows for turtles to be kept upright while they're being tube fed, and then also kept upright after tube feeding to prevent them from regurgitating. Another option for that would be these tires, one on top of the other. This animal is about 20-something kilos, and as you can see, it actually fell asleep after feeding it. I had to touch her to see if she was okay, and there she woke up. But this is a way of preventing them regurgitating after being force-fed. Right. Another basic thing. So one of the basic approaches, obviously, blood collection, like in any other animal. So where do we do that in sea turtles? There's several spots where you could do that, but we usually use the external jugular vein or the dorsal cervical sinus because it's very big. It's very easy. You can get the amount of blood that you really want, well, depending on the size of the animal, of course, but it's really easy. So it would go like that. Ideally, you would have to stretch down the neck, and where you have this red crosses is where you would put your needle in. And this is how it looks like. So ideally, yes, you have to stretch the neck. It is much easier if you do that, but in very big animals, sometimes it's just impossible and you still get it. You just need a bigger gauge needle, an 18G, sometimes longer than the 50 or the 75 millimeter, usually work better. Oops, sorry. This cervical sinus, we use it also to give IV anesthetics or fluids in bolus if we need it. Sea turtles go with propofol, for instance, but you can use other anesthetics as well. If anybody's interested, we can give you several protocols. We go with dexmedetomidine, alfaxan, and many others. Right, so we just wanted to show you a few cases of what we usually see. And the most common pathologies, obviously, we have the anthropogenic and the natural causes. But for us, the most important ones are the anthropogenic, because this is what causes most of our sea turtles to come into the rescue centers, especially interaction with fishermen, entanglements, and traumas. And we wanted to show you what these 3 things do or cause in the sea turtles. So obviously, interaction with humans is never too great for a sea turtle, unfortunately. And hooks and ghost nets, especially. Ghost nets are really damaging, but also plastics that we keep on pouring down to the sea. So what we see is that sea turtles, all of the sea turtles that come into the rescue center have ingested plastics. All of them defecate plastics. It is still yet being studied if microplastics are affecting sea turtles' health, but if they're affecting us, I don't know why they wouldn't affect sea turtles. This slide up here, it's in Spanish, but it says you can see the difference. They can't. So sea turtles feed on jellyfish, and if they see plastic floating by, they will just grab it and eat it. And the one down here is these plastics that hold the cans together. So she swam as being a small turtle into one of that, and it just she grew into it. So we need to be really careful on how we dispose of our plastic residuals. So what all this causes is basically, first of all, drowning. Drowning is generally a consequence of bycatch, but also if they ingest lots of plastics, they end up being so weak that they can't come up to the surface to breathe. So the drowning image is what you see here on your left, which would be the lungs completely filled with water, and a very non-reactive sea turtle. Now, the good thing is that sea turtles are incredible animals, and it can really be reverted if we act quickly. And what we do is we intubate the turtle with a tracheal tube, as you can see here on the right. We tilt it down to make sure that any water that is left, we kind of help get the water out of the lungs like that by gravity. We monitor the heart rate with an ultrasound to make sure it's still alive, because even if you don't see them breathing, they are really resistant animals, and you can hear or you can see the heartbeat with an ultrasound or a Doppler, and then you can hear it like really faint, like every minute or so. So you never lose hope with sea turtles. And then you supplement it with oxygen. This, what you see here, is a 25G needle that we use for acupuncture. This is to stimulate the breathing response. It is commonly used also in the tail of the sea turtles. And there is actually a commercial device that was that exists. It was developed in the States, I believe. That's called Mary Turtle, and it's a resuscitation device that acts the same way. Well, a bit more, obviously more efficient. It's like electrodes on the base of the nose. So it is clearly documented that you never lose hope with sea turtles. You always try it. Right. Traumas, we see lots of them depending on the country, especially the images. These are all images from the internet, well, most of them. So the one in the middle is one day of boat traffic in the world. And the one on the left, this one is a sea turtle with an open head because of a machete. Sorry, I'm from Spain. My English is sometimes not great. And this on the right are traumas caused by boats, by helix of boats, or just by boats running into the sea turtles. Now, big sharks do create traumas or cause traumas to sea turtles, but it's not that common, especially not in the Mediterranean where we usually work. But we have seen some severe shark wounds as well. So we would do the treatment for the different types of trauma in the same way that you would do for any other animal. So you look at the seriousness, you clean, disinfect the area, and then obviously if there's a fracture, you stabilize it. The only thing that changes here is that because it's a marine animal, you need to make it waterproof, because otherwise you won't be able to keep it in its natural environment, right? So what we use is fiberglass or acrylics. For very deep wounds that take months to heal, actually, we use a lot of beeswax, for instance, and we use manuka honey as natural antibiotics if you would like, but you still have to cover them prior to being able to put them in the water. The beeswax is kind of water repellent, so it's a good thing because it can be removed every 4 days, disinfected, cleaned, and then placed back. And the acrylic is something that it's not that easily removable, so it's better to wait until the wound is completely healed and not infected anymore before applying it. Entanglements is something that we want to talk about because the ghost nets are really provoking problems. And last year, between September and December, we had 30 turtles coming into one of the rescue centers we help at. And all of them were entangled, and all of them, except maybe one or two, had to be amputated due to that. Why is that? Well, as you all know, entanglements cause compression. There is a lack of blood flow. So you can see here the foreflipper completely edematous. And at the end, we never get, or it's seldom that we have a fresh wound. These animals, because they're so resilient and so resistant, it's months and they don't die. And then when they get to the rescue center, when finally a fisherman finds them, it's so necrotic, and we have secondary infections by Vibrio, Aeromonas, Pseudomonas that is just impossible to save. So we need to amputate them. In this case, this was a very small turtle. She was not even 2 kilos. She was very young. She had a fracture on the humerus. So what we usually do is, if it's not completely affected, we try to leave at least a bit of the bone so that it has a bit of traction when we release it, which was the case actually in this turtle. Sometimes it's impossible to save anything and we really have to remove the entire bone. So this little turtle was so damaged that it was almost already amputated itself. We didn't have to do much, just anesthetizer. This is propofol. We then used isoflurane, and it almost came up down on its own. We only had to cut a bit and cauterize, and that was about it. as an interesting fact, we do use laser therapy like in many other animals. Basically, the low intensity laser therapy, and we use it as an anti-inflammatory and analgesic to speed up the healing process. So that's what we did in this sea turtle. And it actually went really well. In 3 weeks' time, she was doing really good, and within 2 months, she was released. Because we can release 3 flippered turtles. We could even release 2 flippered turtles, but the flippers have to be opposite. So one turtle that is missing both front flippers or both hind flippers, or both right or both left, can never be released. It's not going to make it. With one missing flipper, it's not a problem, but of course it's a problem from a conservation point of view, because a female that has a missing flipper won't be able to nest, and a male that has a missing foreflipper or front flipper won't be able to mate. So we have seen females, or I haven't seen one, but it has been described that in some nesting sites, 3 flippered females come out and do the nest. So there's always hope, but with 2 flippers, no chance. In the upper video, what you're going to see now is a sea turtle that has 3 flippers, and it has 1 hind flipper missing, the right one. And as you can see, she's doing pretty well. It's actually a bit too fast for the diver that was following her. And on the other video, you can see a turtle with a missing front flipper, and she struggles a bit more. It takes them a while to get adjusted, but they do manage, and we have seen them over the years. There are sightings. So once we released one that had been for many years in a rescue center, we had a missing front flipper, and she was from Atlantic origin, although we found her in the coast of Catalonia in Spain. So she was released where she was found, and we thought she would manage just fine around, because it's a high density area of sea turtles and it's a feeding ground. But she actually managed to cross the Strait of Gibraltar and went off to Florida. It took her no time. In 2 months or 3 months, she was down in Azores, and by 7 or 8 months later, she was in Florida. So that was quite amazing. These animals are just incredible. So this is what we mean with missing flippers in the same site. On the upper video here, you see her name is Rambo, and she has 2 missing flippers and a stump kind of thing. So it's both from the same side, from the right side. So she has the left foreflipper is okay, and the left hind flipper is a bit affected, but she still has it and she can still use it. But on the right hand side here, the hind flipper, it's only a stump. So because she was not straight euthanized, because she was in really good weight and body condition when she arrived at the rescue center, which we thought meant that she could actually manage this way, because she came like that. We didn't do anything. It was amputated by here. You can see also that this one is affected, the left one. She was just heavily entangled, and she lost the flippers at sea, and she managed to survive that. So we were a bit reluctant to euthanize this animal. It obviously needs an ethical review every 6 months and a long-term plan. But usually animals with missing flippers from the same side, like this one, don't have a chance. This one wouldn't be able to come up and breathe. It needs to be kept in 10 centimeters water. It's just quality of life is clearly compromised here. And this animal is just never, not only releasable, it cannot lead a sea turtle life. Right. To finish with the cases, just to let you know, if you're interested, the sea turtles can suffer from decompression sickness. This was discovered a few years back by the Oceanographic of Valencia, together with several teams, but it was led by them. They actually won a prize for that, a conservation prize. So what happens is, when turtles dive, it's a bit like with cetaceans, right? So they start with bradycardia, so the heart slows down, and they have an intracardiac shunt from right to left, plus a sphincter in the pulmonary artery. All this means that the blood flow in the pulmonary artery is heavily decreased, so there is no blood flow to the lungs. This is how they dive. So what happens when there is stress? What happens when they're caught up in a net? It doesn't matter if it's really deep, because people think that decompression sickness, like in humans, it's related to the depth of the diving. This is not the case in sea turtles. Even if they're in 2 meters depth, if it takes more than, and I don't know the exact time, but it's the length of time that it means that they're entangled in this net, not the depth. They're very stressed. They don't control. They don't know where it's up or down. So the cardiac shunt and the pulmonary sphincter, they fail. Plus, the bradycardia turns into tachycardia because of the stress situation. This means that the blood flow in the lungs goes ballistic, and they start to absorb nitrogen. Actually, in severe cases, this leads to death within hours. What do we do? When the fishermen call us saying that they are deep water trawlers, and they say, we have caught a bycatch of a sea turtle, and it's really active. It doesn't stop moving. It looks great. Well, that's not normal. Sea turtles should not be moving like crazy. So this means that it's probably decompressed, these animals, and it needs immediate attention. We have these 4 stages, really. We have normal appearance, the hyperactive, the comatose, and the dead ones. So the treatment is, as in humans, a decompression chamber. So when they get to the rescue center, we have a very strict protocol on what is done on every sea turtle that enters. So you take x-rays and you check if there's gas in the renal veins. You take the blood, because sometimes in severe affected animals, you can see the gas in the blood. And then you do an ultrasound to make sure that there is no gas in the heart vessels. And then you put them in the decompression chamber. We follow human protocols. This was also firstly developed in Valencia, where they have a somewhat smaller decompression chamber, like for smaller turtles. In the rescue center in Barcelona, sorry, this is a slide to show you how it looks like. So on the left, you see a normal turtle, in the middle, the one that is drowned, and on the right-hand side, all the embolism in the vessels. So this is how it would look like when this is a severely affected animal. This is not that the needle is not properly positioned. We did this three times because we believed that we were wrongly positioned, but no, this is actually gas in the bloodstream. This animal actually, we got 2 animals, 2 decompressed animals that day. One made it, the other one didn't. So down here, what you see, this castle here, is the decompression chamber that was done for the rescue center in Spain. We have learned from this design that we need a window to actually look at the animals. This little thing up here is too small, and it needs to be less heavy because we need a crane to lift it up. But obviously for bigger turtles, you need a big structure and it is heavy, but it would need to be a bit more handy. So new ones are being designed, and hopefully that will make things easier. As for diagnostics, up on your left, you see the X-ray of the sea turtle, lateral X-ray. You see the lungs, and this red circle, what it shows inside is the kidney. Well, we shouldn't be seeing the kidney. If we see the kidneys, because there's air in the vessels, you see that, and the lungs up here are completely collapsed. So after 12 hours decompression chamber, the lungs are back to normal, and the air in the renal vessels has disappeared. This is published. Should anybody be interested, please let us know. We can forward you this paper if anybody's interested. And that would be all I had to talk about the cases. And I'm going to give it over to Matt to talk about the really important stuff about sea turtles, which is the husbandry.
Thank you, Tania. I think the most important thing for me, I think is worth always bearing in mind, is that in wildlife and rescue situations, the more charismatic you are as a species, the more sometimes your basic requirements are forgotten. because you kind of get carried away in the fact that it's an amazing elephant or an amazing tiger, and we need to just be really mindful to not forget the basics. So with sea turtles, they are very much exothermic, and they exhibit classic heliotherm behavior that we see in other reptiles. So they bob around in shallow water, they dilate the blood vessels in their carapace as a way of thermoregulating, and really use directly the sun's heat to warm themselves. And remember, these reptiles, everything is altered by them, by changes in their temperature. So in even things like the pharmacokinetics, if we have a drug that we give and their metabolism is too slow, paradoxically, we actually risk overdosing that animal because it won't have excreted the whole dose by the time we give it a second one. So really keeping things in their preferred temperature zone is absolutely crucial. Obviously, it's very important to reptiles, but again, it's really important to not just get fixated on UVB. There's loads of publications about the UVB spectrum being really important for metabolism of calcium, but with sea turtles and with lots of other species, we need to consider the other spectrums as well. So UVA for those circadian rhythms. When we see our reproductively active female sea turtles, they'll be very driven by the presence of UVA. There's certainly some evidence now that the absorption of UVB is shut down by exposure to UVA. So that's being looked at the moment. So that could be very interesting. And then even UVC, which is obviously the bad guy in the spectrums, even that has a presence and an importance in things like wound healing, because exposure to high volumes of UV across the spectrums will have a slight sterilizing action and will actually reduce bacterial burden in wounds and things. And then also don't forget lux. So volume of light for reptiles, I think, is more and more important. Keeping sea turtles in dimly lit inside environments is really suboptimal. And you have to remember that ectopic mineralization is written up in other reptiles, where these fluctuations in exposure to UVB specifically will cause hyperparathyroidism, which will lead on to mineralization of some of the greater vessels. So these small, what were considered maybe not that significant, really do have a huge part to play. So calcium, again, we think about this in all reptiles, but it's important that we make sure that all the pathways are open, and we need to make sure we maintain that pathway to allow the metabolism of calcium. So the two things above this obviously are really important. We need that UVB, and we also need that temperature, but we need a healthy GI tract. You can give as much calcium as you like orally, but if the villi are not healthy within the GI tract, it won't get absorbed. And it's sometimes hard to comprehend, but there is only a certain amount of absorption of calcium that can go on via the GI tract. So even when you start adding in oral supplementation of D3, it's still not really going to be able to provide the same as a nutritional balanced diet for these animals. And this needs maintaining. Calcium has a part to play in wound healing, but also in just general well-being and maintenance of muscle function and everything. So again, really important. And as Tania said, this can be measured by taking ionized blood samples very easily and just looking at what actually level of calcium you've got circulating in that turtle. So again, as Tania has touched on, these animals will go into a kind of cachexic state and just stop eating, sometimes induced by stimuli of stress, but also because of pain and this kind of satisfaction with their setup. And they need to be given enough energy to get them in a positive metabolic state. Reptiles are very good at ignoring their wound healing and ignoring redevelopment of kind of repopulation of muscle cells and things in a way to just survive. So they are tough beings, but they will just shut all of those things down if they don't have the available energy. So really the holistic approach needs to be that we need to have all of these things on board. We need to be going through that discussion pathway and that plan to make sure that we provide all of these things for the individual turtles. And obviously they're aquatic, so there's a big difference between living in the sea and living in a tank in captivity. So once that water becomes foul, and sea turtles are quite dirty animals, the water quality needs to be good. It needs to be maintained. And those life systems to keep providing clear and pure water with a low bacterial burden is actually really, really hard to do. And lots of places will work on a dump and fill, so just dumping the seawater and then replacing it. And that's fine, but you do need to make sure that where the seawater is being collected from is not contaminated with sewage and is not kind of already bad before it starts. And storage of seawater is hard longer term. So it sounds idyllic that you'd have a big tank of seawater sitting somewhere, but that in itself requires a huge amount of life support systems and a regular supply of electricity, which in some of the countries we're involved in is tricky as well. So sea turtles and chelonians generally, they have a high cognitive ability. There's been some amazing studies done in the UK about terrestrial tortoises and how they are actually quite high sentient beings and they're thinking things. So this makes them considerably, you know, there's the possibility of causing them stress, and stress being a factor, and mental stimulation is needed. And this can be in the form of enrichment. And again, we're happy to share some papers on enrichment for sea turtles, but also just thinking about their environment. And this kind of needs to peak pre-release. So you need these animals to be physically and mentally fit and active. And it's worth noting that sea turtle behavior, if they're in pain, is to just stop moving. So whereas in other species, you know, that's a kind of perhaps a good sign in some species, but in sea turtles, they just mentally and physically will start to just turn off and stop moving. So you need to make, as Tania mentioned before, some really good quantifiable welfare assessments on a regular basis. So feeding tubes, you often can't avoid them, and they are easy to place under anaesthetic. And again, Tania has said we can share protocols for anaesthetizing these things, but they do need placing, and they reduce a lot of stress because the kind of manual restraint is very stressful. And you have to be mindful, if you're wrestling with a sea turtle, it's using up calories all the time. So if your interaction with that turtle, it burns off 500 kilocalories, and you're tube feeding it with 500 kilocalories, other than making yourself feel better, you haven't actually achieved anything. So really, really need to be mindful of reducing stress. So often the feeding can take place in a lot less of a stressful environment, still maintaining the turtle upright, but not actually handling it around the face can be a lot less stress for it. Sometimes tubes are used to use colonic rehydration as well. So flushing solutions up into the cloaca. And this can be used also to administer laxatives to kind of help the passage of foreign bodies that we see, including the plastics. So tube feeding itself can be quite straightforward. Placing a rigid or fairly rigid, robust tube first, so that there's absolutely no risk that the turtle doesn't bite it off. And also it kind of pushes out of the way some of the papillae that the sea turtles have in their esophagus that kind of snags on the tube and can be a bit uncomfortable. So it kind of slows that down for you. And then a fairly soft tube, some of the equine fold tubes seem to be the most preferable. And most of the time you're passing this into the distal esophagus rather than pushing it through the cardia into the stomach. And that's, again, is why, as Tania said, you need to keep them upright for a significant time afterwards. And with the best will in the world, that's quite hard to do by yourself. I think you set off thinking you're going to be able to hold this 65 kilo turtle up for 20 minutes, and actually you can't. So using one of the devices, as was shown previously, is really useful. And then we're very lucky now in veterinary medicine that we have options as to what we tube feed with. It really comes down to using a semi-elemental food like emerade, which can be metabolized much easier. It's kind of semi-metabolized already, and means that those calories are accessible to that sea turtle very, very quickly. And Tania and I have seen some really good results with this. It kind of gets in their system very fast and can really improve them. I'm not going to say overnight, but within a few feeds. It really is very easy to metabolize and really gets the energy level up. The other option is blending food. So blending up fish in an industrial food processor. As soon as this food oxidizes, the calorific and nutritional content of it degrades. So really, you'd want to be making this kind of blend up for every feed. I think some centers in the past have defrosted fish, blended it up, and then frozen it again. And again, you're kind of decreasing your kind of the standard of the food you're tubing. And again, as I said earlier, it's no point in tubing a load of poor quality food if that involves you actually stressing that turtle out. So I think the semi-elemental food is incredibly useful, and we're really kind of using that more and more now. So I just wanted to end with a case study. So this was a sea turtle that Tania and I were dealing with that has a kind of blunt and sharp traumatic wound to the top of its head caused by a fisherman. A well-meaning person has used the classic Oxytec purple spray on its head, but the grey kind of brown area you can see in the middle is her brain. When Tania and I met her, she was been in the centre for some while, and she wasn't feeding and she wasn't moving around, and she was really in trouble. So with the best will in the world, Tania and I kind of stepped in and supported the veterinary surgeons on site to kind of push her forward. So we anaesthetized her. There was concerns about anaesthetizing her because she was quite weak at that stage, but for her welfare, that was the best option. We placed an esophageal feeding tube. We put her on some good analgesia. So in this case, we gave her tramadol, and we started to tube feed her. And we also increased her UV light. So we put her into a warmer environment, gave her some UV light. And this is the wound healed on her head. She started eating about 4 weeks after we kind of intervened. And this is the wound after 3 months. It took 3 months for it to heal completely. And she changed the analgesia, made her move around more, which helped with her circulation, which you could kind of guess probably helps with her GI tract mobility as well. And she started to take dead squid and all sorts very quickly. So this is probably the worst video we'll show you, but also the best. So this is Chanel being released back into the wild. And this should be the aim of all of this, is to make sure that we get these sea turtles back in the wild. I think there's quite a lot of focus on the baby sea turtles, but actually releasing these adult females that could breed in the next couple of years, I think is really, really, and the focus needs to always be on getting these back into the world. We shouldn't be aiming to have lots and lots in captivity unless they have a very, very clear defined role in education. Okay, thank you very much for your time. I'll hand you back to Tania.
No, I just wanted to thank you all for listening to us. This is something that is very important to us. We strongly believe that even though it doesn't make an impact, a great impact on conservation, it does make on education, like Matt mentioned. And if people really don't see, if they don't know what all these plastics, all these ghost nets, all this trash we produce do to these animals, we will just keep on doing it. So we really think that each individual is very special and is important. And we are, as Matt said, happy to just hand out papers or any further information you might like. Thank you. Thank you very much.